Let's talk about that big drug that's making major waves and disruptions in markets. It's Novo Nordisk's Ozempic. George Tsilis with a deep dive here for us because George couldn't think of a better man to do the job, trying to figure out whether or not this is really a hype or a major disruptor. I mean, dialysis center and health provider Davita today just crashing. Basically doing exactly what Pepsi and a bunch of the other snack businesses did a week ago. Have you ever seen anything like this? I mean, it's amazing.
It is. And let's put context to this as well, because look, Ozempic is a fad, if you ask me. I think it's going to be fleeting, but there's also an element of the market, Well, yeah, it's expensive, by the way, as well. Look, I think there's an element of, it's creating some frenzy. It's creating some news. It may end up creating some problems for the food companies, the packaged food companies, and even companies today that are associated with either diabetes, like Dexcom, for instance. They make diabetes medical equipment and, of course, monitoring devices that you wear. Baxter, which manufactures multiple types of medical equipment, but some of it is dialysis equipment. And Davita today was down significantly because they are focused as primarily a kidney failure or a dialysis treatment centers, again, across the nation. So, all these stocks have been taking some hits as of late, and the food companies as well have also been down. But let's look at it from a market context first. One, you have to consider what's happening in the last 6 months or so with a lot of these stocks. Interest rates have significantly moved higher. They pulled back a little bit in the last week or so. But I think that's one of the overarching problems that is created for these companies, which typically pay dividends again. And so you're seeing some preference move away from dividend payers like utility companies, food companies, medical device companies, into, of course, areas where there's higher risk-free rates of return. So I think that's a bigger issue for a lot of these stocks. Now, moving into the aspects of Ozempic, ideally speaking, again, it's a diabetes drug. It's approved for treatment of diabetes, but it's off-label use for weight loss. And now, Novo Nordisk, which basically has the rights to Ozempic, basically had stopped an early-stage trial to actually have the drug used for treatment now of kidney failure, which again is another one of the adverse impacts from having diabetes. And so we're seeing a lot of the stocks that make dialysis equipment like Baxter, Davita, which is the dialysis treatment centers, all move to the downside today.
Yeah. So here's where I would say that, like, the argument, I think, if, again, like, this is, like, pretty early data, I guess. I mean, how would you describe the status of the trial here, George? Because the point I'm going to make, to kind of jump ahead real quick, is that price of the treatment is going to be much less a factor when it comes to kidney health than it will beverages, right? I mean, you're gonna, if this is life-saving type stuff, you're gonna have insurance that's gonna play a role. People are gonna be more willing to pay for it. If it's just like aesthetic weight loss stuff, then the $900 price of Ozempic is a limiting factor. But as far as like the healthcare side goes, price not so much a limiting factor. So the trial that we're at here, I mean, do they need to do anything further from here, or does it seem like the fact that they stopped it early due to likely approval means that this is really going to be a treatment commercially available soon?
Well, that's a good question. A lot of times you'll see this often in medical and biotech companies where they actually meet the endpoint data that their objective hypothesis is intended to meet before their respective deadlines. So this is not necessarily something far-fetched. I think it caught a lot of headlines just because of the craze that's going on with Ozempic. But I suggest you'll probably see another clinical trial in some capacity move forward. So they're basically moving forward earlier than anticipated is what's going on here for Ozempic to be used, of course, for the treatment of kidney failure. But you have to bring context into this because at the end of the day, Ozempic is not a substitute for bad lifestyle choices. Again, so that's where I think there's a mispricing in a lot of these stocks. I think at the end of the day, also, if you look at companies like Davita, not all people who are in late-stage renal failure, kidney failure, are diabetics. nor effectively do you need to have diabetes to be in kidney failure. If you look at the breakdown, for instance, of Davita's revenues, the majority come from Medicare, which means that people who are older probably have a high probability of going into kidney failure, and that may be absent of having diabetes. So there's a lot of mixed data going on here, a lot of mixed signals. But I think at the end of the day, this is an opportunity. I think it's an opportunity not just in this space. I think it's an opportunity in a lot of the defensive sectors of the market, including the foods and utilities, aerospace and defense, by the way, also moving higher, of course, because of what's going on in the Middle East. But those stocks were also down significantly prior to the war breaking out, because those are typically dividend-paying defensive names that have had fallen out of favor because of higher interest rates. So I'm not putting too much emphasis on this drug to, of course, cause a lot of these companies to go out of business, nor to have some of their stocks go down significantly over the past few weeks or so. And prominent declines like we saw today, again, I suggest some opportunities versus, again, pure substitutes away from them.
All right, nice, okay. We'll say I feel like it still is going to be maybe a more sound disruptor from the healthcare side, that ironically than like the weight loss. I mean, not like the weight loss medical industry. It certainly is going to be disruptive there, but like to your point, from the snacking business and stuff and the habitual stuff. All right, thanks for the thoughts, George. Big story, so can't talk about it enough.